Hi nurse family, welcome back to my channel, Nurse Erica. Today we're going to talk about a very important topic. We're going to talk about how you're going to pass your next nursing exam. Now if you're watching this video, you might have already taken several or one or two nursing exams and you know that it's not like any other test you've ever taken, okay? Or maybe this is you're getting ready to take your nursing exam and you're watching this video. I hope that you're the latter, because I'll be honest, the first time I took a nursing exam, I had my mind completely blown. I had read, at least I thought I did. I read and I prepared and I wasn't ready. So stick around. I'm going to teach you how to get ready and how to be successful on your nursing exams. Now, if you haven't already, go ahead and subscribe and hit that bell notification. That's going to allow you to be notified every time I post new videos. And go ahead and leave a comment on video topics and things that you want to see from me, because I'm definitely listening. This video was inspired by a student who DM'd me on IG and said that she's still having trouble figuring out how to study. And so let me know anything that you would like to see on my page. All right, well, let's go ahead and get started. All right, so the first thing that I'm gonna do is tell you some of my biggest tips for studying, okay? Now, these tips, you cannot worry about other people and what they think about you with these tips, okay? Because they're crazy, but they work. I had to go into my nursing museum and pull out, I would say the big kahuna, but do you guys even know what that is? I had to go pull out this baby. This is my highly coveted Med-Surg binder. Now, mind you, I was looking at the dates. These are from 2007, okay? For some reason, I haven't been able to give up this binder, but I'm sure that a lot of this stuff is outdated. But I'm so happy today. I was thinking, okay, maybe this is why I could never throw this binder away. It's so that I could share it with you beautiful people. So the first thing that I want to tell you is that you need to get organized, okay? My students, or every nursing student, gets hundreds and hundreds of papers and PowerPoints, as you can see, as evidenced by this book. And this is not even my clinical documents. This is just my class documents. These are just from my lectures, okay? My clinical documents, maybe I'll do another video on that. I used to have in a separate fold just my lecture notes, okay? And so this is gonna really help you. Let's go started. My first tip is organize. So I'm going to show you how I organize my binder so that it's very easy for me to keep track of what I need to study. Okay, so what I want to show you is how I would actually organize my binder. Now, obviously you can tell that every single piece of information that my provider gave me, or provider, I'm back at work. Every single information that my professor would give me would go right into this binder, okay? But more importantly was how I organized it. Now, many students will organize by topic. So for example, endocrine, diabetes, things like that. But I found it more beneficial for me to organize by test. Okay, and so it was really helpful that every single thing I have for test 1 was in this binder. Everything for test 2 was on this side. And so sometimes I would even take it out and put it in a folder or something if I was traveling and I wanted to study just from that test. But where this really came in handy is when we got to finals week. So you already know that most nursing exams, most nursing finals are going to be cumulative. And so having my binder organized by test was very helpful to me, because when finals came around, I would already know which exam and which topics I struggled with. And so that's where I would put a lot of my energy in. If I know that I did really badly on test 1, I'm going to go ahead and start with test 1 and focus on test 1 and then move down the line. All right, so that's how I organize my binder. So now that we've talked about how to organize your binder, let's talk about how to take notes. Now, I know a lot of my students use their laptops and they'll take notes on their laptops. That's completely fine if that works for you. Me personally, I like to write everything down. And there is research that proves that when you write, it helps you to memorize, okay? So this will still apply to you if you do use your computers, but just keep in mind that you might want to try writing. If the computer note-taking is not working, you might want to try a different strategy, okay? So the first thing I want to say is, if your professor uses PowerPoints as their teaching tool, as a way of getting information to you, go ahead and print those PowerPoints out, okay? You're gonna wanna print your PowerPoints in handouts, and that's gonna allow you to have the space here so that you can write any notes down either during class or while you're reading in your textbook. Now, PowerPoints are not gonna have every single piece of information that you need to know, okay? Your PowerPoints are really just, if they're done correctly, bulleted points on information that is important. So what you want to do is go ahead and use each slide as your guide as to what to read in your textbook. You may have already noticed that your syllabus is asking you to read several chapters, okay? And that's really challenging. Some of these chapters can be up to 40, 50 pages long. And so to read 10 chapters for in 1 week could be very challenging for many people. So my biggest strategy is to use your slide and that'll help you to see what paragraph you need to go and read in your textbook, okay? So before I get into note-taking, you might notice that I'm writing in purple ink. Okay, I know that many students like to use different color pens. They'll use different color highlighters. If that works for you, that's great. A lot of people are very visual and that helps them. For me, it just took way too much focus and attention for me to try to remember what color ink I needed to use. And so that really didn't work for me. But I did like these purple pens that I would get from my gym. And so you'll notice that my notes are in purple. Now, what I want to show you is how I would take notes, okay? Okay, so you'll notice here, first of all, this is my MedSurg PowerPoint, and you'll notice that this slide is about medication administration, okay? And so what I did was I used these slides to guide where I went in the chapter, and then I took notes. And so I wrote everything down that I thought was important from the textbook. Now, once I write all of these notes down from the textbook, I am not going to go back into the textbook into that chapter again. I'm going to continue to just use my notes as my guide and read from my notes. Now, what you also want to do is that as you're writing this down, and now mind you, this might sound a little crazy, but it works. As you're writing these things down, you want to start to talk through them in your head or out loud, okay? And so if I'm going to write not allowed to hold orders, they must be discontinued and started again with another prescription, I would say it just the way I'm saying it to you now. So I'm not allowed to hold orders. I'm going to discontinue the order. I'm going to have the provider discontinue the order. And then if they want to restart this medication, they're going to have to go ahead and reorder it. And so saying it out loud is going to help you to process that. Sometimes you could be reading something and without even realizing, you're thinking about something else, like, oh, I got to get my nails done. I want to go see my friend, right? So reading it out loud and really talking through it is going to help you to actually process what you're saying. All right. So this is a three-step strategy here. You're going to go ahead and print your PowerPoint. You're going to go into your textbook. You're going to use that slide as your guide. So you might want to go ahead and highlight in your textbook the most important points and then go ahead and copy them onto your PowerPoint. Once you do that, you're not going to open that chapter or read about that topic in your textbook again. All you're going to do is use your PowerPoint. So you'll continue to read and study from your PowerPoints from one place. Oftentimes, students can't find a way to organize themselves. And so they have this textbook and that textbook and their med book and their PowerPoint and their notes. And it could be very confusing. You want to have everything in one place. So what I would do is I would just literally have my PowerPoint, now obviously it'll be several, you just saw my binder. That's why I like to divide my binders by tests, because I would have all the information on this test together in one place. So what you need to remember is that most of nursing is not memorization. Most of nursing is going to be understanding. Now, a lot of times students try to memorize things, but if you try to actually understand, especially in courses such as Med-Surg, Advanced Med-Surg, your critical care courses, that is all understanding. Try to understand why your heart rate all of a sudden starts to increase as your blood pressure is going down. Okay? If you try to understand these things rather than memorizing, you're going to see that you can rationalize your questions a lot better. Because if you're answering a test question that you can't remember the answer to, you could at least go through the choices and see which one makes sense for what the question is asking. Okay? Now, when I did have things or information that I needed to memorize, I found it very helpful to use my flashcards. And I kind of laugh a little bit when I pull out my flashcards, because I used to get a lot of just flack for having flashcards. And then I put them on a ring. And so, that really took it over the edge for me. But anyways, it was helpful, and I do recommend flashcards if you can. Now, these flashcards are for my maternity and peds. I took those courses at the same time. So these are my maternity and peds flashcards. And so if you notice, I also labeled my flashcards by test. So here I had maternity number 3. And I labeled the topic, so complications of pregnancies. Okay, and here I have DIC. And let's see what's on the other side. So here I have everything about DIC. So causes, signs and symptoms, and treatment. So what I would often do is I would basically look at the topic and try to say all this information out loud. So obviously this is already after I've already studied, and this is a way of testing if I remember this information. So what I would do is, okay, DIC, and then I would talk in my mind, all the causes and complications and treatment, and then I turn over to see what I missed. Okay, so let's go over to peds. Let's see what I have over here. This is peds number 2. So I have spina bifida, signs and symptoms. And again, so I would say all the signs and symptoms, and then I would turn over and see how I did. Okay? So the reason why I recommend flashcards, now, if you're a city girl like me and you're taking public transportation all over the place, or if you're working, flashcards are very beneficial because it's super convenient. I worked as a companion in the city, and so I used to sit with patients on one-to-one. And I would take the train into the city, and I would have my flashcards with me on the train. Super easy. If I had to, stand up on the train, if I was sitting in a public train, it didn't matter because it was super convenient to carry. I didn't have to carry my big textbooks or notebooks, right? And then when I was sitting one-to-one with my patients, if they were calm when they were sleeping or they were having treatment done, I would just pull out my flashcards and I would go ahead and read. And then if my patient woke up, I could just go ahead and put my flashcards back in my pocket. They fit in my scrubs perfectly. And so if you're someone who's always on the go, and you're having periods of times when you're just sitting, flashcards could be very helpful. Now, keeping in mind that as you're writing down these notes, you want to go ahead and read it out loud and pretend that you're teaching yourself or teaching someone else this information, okay? And like I said, I recommend not having all the information on one side. I recommend just having the topic on one side and the information on the back, okay? So that's flashcards. Okay. So the next thing I want to talk about is where to study. Now, where to study is going to depend on the kind of studying habits you have. So for example, I got used to being in a very loud home as a child where there was always people and there was always things around. And I got in the habit of either watching TV or listening to music while I study, mostly listening to music. And so I really have trouble studying in a very quiet room. It's actually distracting to me when it's quiet. So what I found, and obviously this is pre-COVID, but there's other ways that you can get around this. What I found was that going to cafes and sitting in a cafe where people were coming and going was enough excitement to get me stimulated, but also motivated to study. Okay. And so, yeah, was I distracted sometimes by people walking around? I was, but that's what helped to keep me awake. My biggest problem was I used to fall asleep when I studied. And so being at a cafe, I'd get myself a hot chocolate or a green tea. I'd get myself a muffin or a cookie, something to kind of just give me some energy. And I would just basically sit there all day and study. Now, if you're a person that likes it quiet, or if you're going to want to read out loud, a lot of times I would walk around my room and pretend I was teaching someone something. That's also probably because I'm a teacher. I just always had it in me to want to teach. But walking around my room was also very helpful, just walking around and pretending as if I was teaching this information rather than trying to get all this information into my brain and feeling overwhelmed by how much it is. That's another tip. That's a random tip that I'm going to tell you. Sometimes when you're studying, you can get a little overwhelmed by how much information you have to know, and just thinking about, oh my gosh, am I going to be able to learn all this? Don't even worry about that. Just continue every single day to study and to read, and you are going to learn all this information, okay? Because countless others before you did, okay? So don't think about how much you have to study. Just take it step by step. Now, some places that I recommend are maybe the library. I know that the library has some private rooms. Some libraries have private rooms that you can rent. Or at least different spaces for studying, so you can go ahead and reserve those, whether it's your school library or a public library. Many cafes now do have indoor and outdoor, so considering we are in a COVID-19 world and a lot of places are not allowing you to sit inside, sitting outside is nice. The other thing that I used to love to do is just grab a blanket and a smoothie and either go to the park or sit on campus. I lived on campus, so I would just go outside and sit on the grass. And so again, it's all about how to stay up, how to stay motivated and stay focused on what you're doing. All right, so that's my study tip on where to study. Okay, so another tip that I have is if your professor will allow you to record your lectures, go ahead and record your lectures. And although it could be very difficult to listen to this more than once, it could be very helpful, especially if you're someone who's driving. So I taught you a tip on if you're someone who is a commuter and you're going to be on the buses and trains, flashcards are very helpful. But if you're someone who's driving, please don't read while you're driving, but you could go ahead and record your professor's lectures, or you can go ahead and record your own self studying and reading these things out loud. Okay. Lastly, you could also put on videos. You're so lucky in this day and age that you have all these YouTube videos with good information. You have a lot of good nurse educators that are out there putting excellent content on going through pathophysiology and complex medications. And obviously, you shouldn't be looking at your phone while you're driving, but you can absolutely be listening. There's also audiobooks on Audible that you can also purchase, okay? And so definitely, if you're someone who can listen and retain information, it would be very helpful. I also sometimes will listen to audiobooks while I'm exercising, while I'm working out, rather than listening to music. I will just put on a video or an audio on a topic that I want to learn more about. And so it does really help and it does really work. Okay, so let's talk about study partners or study groups. Now, I'll be honest, I was never really a person who was good in study groups. I often got a little discouraged when I would show up to a study group and I had already read through topics and chapters and some of my classmates didn't. Also, I'm very chatty. And so oftentimes I would find myself just talking, especially if you don't have the right study partner. Like I did have a short period of time where I was studying with two of my really good friends, and they were focused. That, you know, they were the girls with the different color pens and the different color markers and the flashcards, and you know, we would rent a room in the library and have a board where they would write. And so those were some of my best studying times. But for the most part, I really found it challenging to study in a group. If you're going to study with a group, I would say don't make the group too big. I think 2 to 3 people is perfect, okay? And you want to make sure that you have someone who's even more motivated and more focused than you are. Definitely not the opposite, okay? Because what's going to happen is that person's going to bring you down. That person's going to distract you and kind of bring you backwards. And so you want someone who, you know, if you decide, okay, let's read chapters 2, 3, and 4, and let's discuss it. And when you show up to your studying group, that they're going to read chapters, you know, they have read chapters 2, 3, and 4, and they're ready to discuss with you, okay? Now, what I suggest is that before you meet in your study group, that you have read the information and that you feel like you kind of know the information. And what you should do is that you should say to your friend, okay, I'm going to cover hypertension, and I'm going to teach you about hypertension, and you're going to cover diabetes, and you're going to teach me about diabetes, okay? And so obviously you're both reading both topics, and you're both learning both topics on your own, but when you're coming back, you're going to pretend that you're teaching your classmate that topic, because teaching someone is also another great strategy to help you remember this information. And so that is why oftentimes, even if I wasn't actually working with someone, I was always pretending as if I already knew this information and I was teaching it. Okay, so just be careful if you're working in study groups. Make sure that it's someone who's going to lift you up and help you, not someone who's going to hold you back, someone who's just going to be complaining about the test and complaining about the teacher and, you know, just really not helping you at all. Okay, so my next tip is that you should be studying every single day. And when I tell you the amount of hours, I could already imagine the face you're going to make, because it's the face that my students make whenever I tell them. But you should be studying at least, at the very minimum, 6 hours a day, for not before a test, but every single day. Okay. And so you want to read before class, you want to read after class, you want to slowly every single day put this information into your brain and reinforce it by studying it again the next day. Okay, and so I've given you several strategies on how to take notes, how to learn the information, and then we have to remember that we have to retain the information. And so that's where, you know, your flashcards come in, but also NCLEX questions is going to be one of my biggest tips that I can give you. Okay, you really want to go ahead and practice NCLEX questions, at least 10 questions every single day on each topic that you studied. So for example, if I just learned about hypertension and I just read about, you know, management of hypertension and signs and symptoms and treatment, now I want to go ahead and answer NCLEX style questions. And why is that? Because if you haven't learned already, NCLEX style questions are also how your teachers write your nursing exams, okay? And so they are not like any other test questions you have ever taken. You're going to have choose all that apply. You're going to have choose the best answer, meaning that other answers are correct as well. And so you really want to start to prepare your mind to be able to read these kind of questions and pick apart, okay, this is just a distractor. This is important. This is what it's asking. It's asking for an action. It's asking what the nurse is going to do first. And so as you start to practice NCLEX questions on each topic, you'll start to find common themes in these questions. You'll start to realize that a lot of the questions are asking you the same things, just in a different way. And so you could have read every chapter in the book. You could have wrote everything that your professor said on your notes. But if you don't practice questions, First of all, you're not going to know what you don't understand. Practicing questions is what's going to help you realize if you understand the material or not. But even if you did understand the material, you can still fail because you do not know how to answer the questions. So knowing how to answer your nursing exam questions is really half the battle. Okay, and so when you practice these questions, you want to go ahead and not only answer the question, but you want to go ahead and read the rationale. Even if you got the answer correct, you want to read why that answer is correct and why the other answers are incorrect. That's going to give you a lot of information, okay, as to why answers are incorrect are equally as important as why that answer is correct. So just remember, every single day you should be practicing at least 10 NCLEX questions on the topic that you studied, and then maybe right before your test, like the night before your test, just do NCLEX style questions to help prepare you for your test. Okay, it's also going to help prepare you for your NCLEX. Obviously, the more comfortable you are answering NCLEX style questions, the easier it is going to be for you to pass your NCLEX. Okay, I guess one other tip that I wanted to say is sometimes it can be really challenging to read for several hours a day. So what I used to like to do is sometimes break up this time. Now, I know that a lot of you study mostly with videos, and that's great. Videos are great. Obviously, I'm in favor of videos, and I use videos a lot as well when I was in school. But you want to go ahead and also read. Okay, you want to read, and because the reading is going to give you all the information. Videos are just going to give you some of the information. And so reading the paragraph is going to explain in more detail the information, and that's going to help you understand it. So what I say is find a happy medium between watching videos on a topic and reading. I would say maybe read first. Okay, take your notes and then go ahead and watch the video and then take notes from the video as well. But videos are a great way to just kind of break up your day so you're not just reading all day and falling asleep on your books. Okay, so my next tip I kind of talked a little bit about already, but I really want to bring this home to you, okay? Do not cram. Cramming is not helpful to nursing students, okay? Remember that our exams are not memorization. And so if you were just memorizing something, you can cram, memorize it, take the test, and before the test is even over, you're going to be forgetting half of that material because you just stuffed it into your brain. But we do not want to cram. We want to study every single day because we're not trying to memorize this information for a test. We're trying to understand this information so that when we're taking care of our patients, we know exactly why your patient is exhibiting these symptoms, okay? And so really studying every single day and not waiting till the day before and studying for 8 hours and staying up all night and studying is the way that you're going to be successful on your test. Now, once you've done all that you could do, you've studied until you couldn't study anymore, you read until your eyes wanted to pop out of your head, and your test is coming up, I encourage you, obviously, to go to sleep on time, get a good night's rest, okay? Wake up in the morning and take a couple of breaths, take a couple of positive affirmations, remind yourself that you worked super hard, that you studied as much as you could, and that you gave everything you could, and now you're going to go ahead and knock out this exam, okay? You need to tell yourself positive things about yourself. I've been reading comments on some of my students' pages where they talk about, first week of school, I'm already behind. I'm so dumb. I don't know this stupid test. I don't know how to study. That's not going to be helpful to you. What I want you to do in the morning of your exam or the day of your exam is to take some nice big deep breaths to say, I've done everything that I could do, and now I'm going to go pass this test. And one tip that I'll say, and something that I used to always tell my nursing students when they come in to validate, is that on your way to your exam, put some positive, motivating music, okay? Whatever that might be for you. That might be Bodak Yellow. That might be I'm a Savage. I don't know. Whatever it is, you put that music on and you hype yourself up, get yourself excited, get yourself motivated to go there and kick that test's butt, Okay, now I'm gonna have another video on test taking, like how to actually take an exam, but this video is all about studying, so I'm gonna keep that for that video. But just make sure that you go in there just being confident and knowing that you studied and did everything you can. Now, if you didn't study and do everything you can, say a prayer and hope that God will bring you through this. Okay, so those are my tips, and I hope that this was helpful to you and you knock out your next exam. Please go ahead and hit the like button if you like this video. That'll help to bring these videos to more students like you. And if you haven't already, go ahead and subscribe to my channel so you can see when I post my latest videos on tips and tricks to being successful in nursing school. I wish you all the best of luck. Stay positive this year. I know that you're challenged. I know that there's a lot of different things happening in our world right now that are making you feel overwhelmed. Focus and keep your mind on the prize. Keep your eye on the prize. I have faith in you and I'll be rooting you on all the way. All right, bye-bye.